everyone, how are you? It's Francesca here from TripMedic. I'm so happy to be here today with you. We're gonna have a live stream, super fun. I know that most of you must be thinking like this is just gonna be another boring live stream. I know, but this live stream we're gonna have a super special guest with us. He's gonna have all our questions and curiosities, and we are gonna have so much information from him. This special guest is actually Dr. Samir Daoui. He has been a doctor over 35 years, actually. He has been with us in TripMedic since the beginning. We are so happy to have you here, Doctor. Let's have him here. Let's say hello to Dr. Daoui. How are you, Dr. Daoui? How are you?
Thank you. I'm fine. Hi, everybody.
Well, actually,
How
you
is
can
your day?
talk a bit.
Okay.
My day is amazing. You can talk about yourself a bit if you want.
Okay. I'm Dr. Daoui, Dr. Samir Daoui. I'm a general practitioner working in Paris. Graduated from the University of Paris since 1989. I have been working during 15 years in emergency medicine, internal medicine, intensive care units, and that's all. And I have my own clinic since 20 years.
Amazing. That's amazing. So we are just grateful to have you here today, and we are grateful to have you in TripMedic team as well. So before starting, I just want to share with you that all these questions that I'm going to ask you today, we gather all these questions from our social media. So these questions have been asked for patients or people who have followed us on social media, basically. So whenever you're ready, we can start with our first section of this live interview. You're ready?
I'm ready.
Let's do it then. So tell us, in your experience, how hard this past year has been for you?
Quite hard in the beginning with the start of the epidemics. Everything was not very clear during the first weeks, but little by little we knew how to manage with patients, examining them, asking for tests, X-ray, CT scans, blood tests, and when we had the COVID test, we started doing it. And then we deal with everybody and giving
I imagine actually at first it was really hard for you because we go to the doctors to find all these questions answered, to find more information, and you didn't have, you had the same information as everyone actually.
You know, people didn't come that much in the clinics for a long period. And many times we did video consultations, and as we knew the process of the disease, we started giving treatments, and we had very good results.
Amazing.
So yeah.
So actually, regarding the patients, what have you noticed that your TripMedic patients are struggling with the most, and how can you help them?
First of all, they had big anxiety, and we did our best to give them the relief on that, and after we were dealing with them, like in any other situation. Normally,
you actually don't find difference in between your TripMedic patients and your usual patients, right?
They are the same kind of patients, you know. No big difference. No.
Yeah, that's good then. So our next question is, how do you feel about all these different vaccines that are being produced now for COVID-19? How do you think they're going to affect the future of the virus?
I don't feel very comfortable with the idea of the vaccines, because normally to prepare a new vaccine, it's a long process, and with all the problems that we had, etc., the studies and things are not very clear for the moment. We have some vaccines we can trust, but we have to see the effects, the side effect, and everything. And I think that when the time comes, there is no problem to vaccine anybody, but we have to be sure of the vaccine itself and its side effects, and our main purpose is the health of our patients, and we don't want any harm to them.
Exactly.
That's why the most important now is that we have a treatment, we can give it, and we have very good results with the treatment. And when it comes the time of the vaccine, a sure vaccine, we will do it without any problem.
So you think we should wait for the vaccine still?
I think yes. I don't feel very comfortable now at this stage to tell my patient, you can go ahead, you can do the vaccine without any problem.
Exactly.
I cannot take such a responsibility. I prefer to give treatment when the situation is here and make sure that we are going to give the right vaccine.
Exactly. Yeah, that's very true.
This is very important.
Yeah, it's very important. So, do you think that we can conduct ourselves the COVID test? I mean,
as a first step, yes, we can use the COVID test that you can find in pharmacies, and no problem. But it's always very good also to go to the laboratory.
I haven't seen any COVID test on pharmacies to conduct it myself.
You can buy it at the pharmacy, but you have to buy it anyway. And,
exactly.
And we can do it, yes, no doubt, any problem,
But it's better to get like
it's better after, when you have a positive result, it's better after to go to the laboratory and to make sure that it is really positive. And also it depends on symptoms, Many people are positive on the test without being sick. So we have to be careful about that. This is the best way to proceed, I think.
Yeah, perfect. So do you think online consultation effective for both patient and yourself, the doctor?
Yes, it is a real progress, the online consultation. It is something that can be very important, especially when the patient is far away. There is always a way to have a good coaching and to send the prescriptions and to send the treatment when we are sure that we can start the treatment. So it is a very good progress, and it's a good thing to.
That's amazing. I was thinking actually in that because I live in a country now that I'm not where I grew up in, and I just imagine like myself in all the situations, like all the persons like myself having been able to communicate with their usual doctors through online consultation is really good.
It's a very good progress, and I'm an old doctor, and for me the clinical examination of the patient is something very important, but I realize now that we can do many things by video consultation, and to have a very good idea when there is a dialogue with the patient who tells us what exactly is going on and describe everything. We can have a very clear idea what's going on and even start a treatment if necessary, no problem.
Yeah, that's true. So for our last question, we have, what is the advice you will give to everyone watching right now?
First of all, to don't let the anxiety and fear be on you in a very strong way. Things are clear, more and more clear every day, and we know how to deal with it. It is a disease which has a treatment. I hope we will have very soon a good vaccine, and there is no reason to worry in any way. This is the main advice I can give to people: to keep confident, and don't let the anxiety really destroy them.
Yeah, perfect. So everyone, hear Dr. Daoui. So for our next section, we have a game, actually. I don't know if you know Never Have I Ever, but it's super simple. It's going to be super fun. Never have I ever. I will make a statement for you, and you will let me know if you have done it or you have never done it. Okay?
Okay.
So for our first statement, we have, never have I ever avoid a patient on purpose.
No.
No chance. All the patients have to be treated as an equal, right?
Okay.
So our next statement, it will be, never have I ever been jealous of people who didn't choose medicine as a career.
No, I have no reason to be jealous. No. So
You has
I am
always
happy when
to
people
be a
choose
doctor.
medicine, but I am always happy when people choose medicine, but it is something.
Definitely.
You like it or you don't like it. Many people do it
Exactly.
with conviction, and no, there is no reason to be jealous.
Yeah, exactly. Yeah, very true. So never have I ever thought the patient was lying about their symptoms and later realized I was wrong. What do you think about that one?
No, it is not that difficult to know when people are not very clear about their symptoms. No, we can find it, but it happens sometimes. No,
Exactly. Some
yeah,
people
it is the
just want
human
to
nature. It is the human nature, So
yeah, exactly. They want
no,
to get
no.
something they just
Usually we discover when they say the truth or not. But
exactly.
we have to accept it also. Yeah.
That's what it matters. That at the end you discover.
No, not always, not 100%, 100%. Okay, but
It can happen then.
usually we can feel it. Yeah.
Okay, that's important thing. So never have I ever gotten into a fight with another doctor.
No, no, no.
Are you
Maybe it
sure?
happens once. Maybe it happens once or twice, but
Once or
there
twice.
is no problem with it.
Yeah, that's no problem. Difference. There are always difference. The important thing is that afterwards we are okay.
Yeah.
So the last one of this round of never have I ever. Never have I ever gone to a party where people start telling me their issues as soon as they found out I'm a doctor.
It happens many times, but it is not a problem for me.
It's not a problem. You are happy to
No.
help them.
I try to answer many times. Yes. No. I don't tell them go away and no. It is
That would be
it is
rude.
something usual. It is something usual. It is not really a problem for me.
Yeah, that's very good. Well, actually, it gives you the sense that you are like super vocational doctor, that you like your career and you like to take care of your patients. So that's super.
No. It is really a nice profession. So, yeah.
So
Not
actually,
always easy, but
yeah, we finished our never have I ever section. I don't know if you want to add something for us, doctor, before we check if we have any comments from the viewers.
no, everything looks fine. Thanks for TripMedic. It is really a pleasure to work with you, and I hope it will last a long time.
I hope that we can have another interview soon. I mean,
Thank you.
this was like so much fun, and let me tell to everyone who is watching that you can have physical consultation with Dr. Daoui in Paris. Actually, if you are living in Paris, you can have physical consultation with Dr. Daoui, or maybe a video consultation if you are everywhere, like all over around the globe. You can get video consultation with him. And yeah,
Thank
you can book
you.
the appointments on our social media, or well, actually you can go on our website, but we have social media. We have Facebook, Instagram, YouTube, and LinkedIn, so you can follow us everywhere. And thank you very much again, Dr. Daoui, to give us this
Thanks, my
time.
pleasure. Thanks for
I
everything.
know you are a really busy man, but I love to have you here.
Okay, many thanks. Have a nice day.
Yeah,
Goodbye,
you too.
everybody. Thank you. Bye-bye.
Bye. Bye,
Bye.
everyone.
Bye-bye.